I've got great backup today. Well, good morning. Thanks for joining us. We have some important information to share today about steps that we're taking to prepare for the rollout of the COVID-19 vaccine in Idaho. Our state epidemiologist, Dr. Chris Hahn, who you all know, and Dr. Carolyn Bridges, a recently retired CDC expert in influenza, pandemic, and vaccines, which she thought she'd retired, will explain details related to the vaccine in a bit. Both Dr. Hahn and Dr. Bridges serve on our Idaho Coronavirus Working Group. But first, I am not going to miss the opportunity to explain two topics better. First, what the state emergency order does and does not do. And second, what stage 4 of our Idaho Rebounds plan means. The statewide coronavirus emergency order exists for two primary reasons. Number one, it gives Idaho access to state and federal resources in order to protect our citizens and expedite recovery, just like an emergency order for a fire, flood, or other natural disaster. And number two, it communicates to the public that we are indeed in a state of emergency, just like the other 49 states that have active COVID-19 emergency orders in place. The no action alternative to the pandemic response was never a realistic or responsible option. With 1/3 of Idaho adults at risk of developing serious complications from COVID-19 and overwhelming our healthcare system, we must keep doing all we can to protect lives, healthcare capacity, and our economy. Consider someone you know and care about who is in their 70s or 80s, or someone you know who has a heart or respiratory condition. Would you take steps within your control to ensure they had access to medical care in an emergency? Would you warn and encourage those around your loved ones to be careful not to give them an illness that would put their life at risk? Of course, all of us would. And that's what the emergency order does, plain and simple. It follows state law and takes responsible, measured steps to protect our loved ones and neighbors. There are also some misunderstanding out there of what the emergency order does not do. The emergency order does not take away or infringe on your constitutional rights. I would never do that. The emergency order does not shut down Idaho. The emergency order does not give local governments authority to create and enforce mask orders. State law gave them that authority years ago, with or without a statewide emergency order in place. I often hear and read, "Open up Idaho." Idaho is open and has been for months. That's why Idaho is ranked first among states in economic momentum and third for best employment. Under stage 4, there are no state restrictions on business operations and other activities. However, it does include important recommendations that we can all follow to limit the spread of COVID-19 so we can keep our loved ones healthy and our economy open and growing. The good actions of Idahoans and our business community enabled us to move to the final stage, stage 4, of our Idaho Rebound Plan months ago. And that's the reason Idaho is leading the nation in economic prosperity. I've said it many times, Idahoans' health and a strong economy are interconnected. We cannot have one without the other. After evaluating our statewide metrics over the past 2 weeks, Idaho will stay open and in stage 4 for another 2 weeks. That does not mean we're putting restrictions on businesses or individuals. That does not mean we are in the clear or that lives and the well-being of our loved ones who are older, who have underlying health conditions, are still threatened by this deadly and aggressive disease. We did not meet established metrics in 3 areas over the past 2 weeks: for number of reported cases, for percent of positive tests, as well as COVID hospitalizations. As dropping temperatures drive people indoors, we will likely continue to see an uptick in spread across the country. This only reinforces the need for all of us to ramp up our personal actions to slow the spread of coronavirus and keep our kids in school, our loved ones safe, and our economy open. Wear a mask. Keep 6 feet distance from others. Wash your hands and surfaces regularly. Stay home if you're sick, and get your flu shot. I'm taking your job from you. And get a flu shot to not overwhelm our healthcare system. Before we get to our important news about preparations for the vaccine rollout, I want to talk about some of our new COVID testing resources coming to Idaho. Testing will continue to be an important piece of battling the coronavirus and getting our lives closer to normal. I'm very pleased to share that President Trump and federal officials are now making 100 million new Abbott Binax Now rapid antigen tests available to our nation's governors. These tests are inexpensive, simple to use, more than 95% accurate. They give results in an astounding 15 minutes using a simple, less invasive nasal swab and does not require a machine. Governors determine how the tests will be distributed in their states. Many of Idaho's long-term care facilities have already received the tests, and an additional 530,000 tests will be delivered to Idaho over the next 3 months. I am prioritizing schools to be the primary recipients of the new rapid tests. This will be a game changer for schools. The new rapid tests help quickly determine who has and who does not have COVID-19, so teachers and students can be back in their classrooms instead of quarantine. Today, October 1st, Idaho received 35,000 tests that will be shipped to local public health agencies statewide to help support COVID testing in our schools. Now we want to go over the steps Idaho is taking to prepare for the rollout of a COVID-19 vaccine. The availability of a safe, effective COVID vaccine is one of the biggest hurdles to getting back to normal. Idaho has been working hard preparing to make COVID-19 vaccine available statewide when it is ready. The federal government has said its goal is to produce and deliver 300 million doses of safe, effective COVID-19 vaccines starting in January. Congress directed almost $10 billion to research and development in this effort. Here in Idaho, we have been planning for the distribution of COVID-19 vaccine for months. It's important for Idahoans to know that enrolling providers, distributing vaccine, and tracking vaccine doses are activities that are not new to our state agencies. We do this every day at the Idaho Department of Health and Welfare with our immunization program. At the same time, COVID-19 vaccine distribution presents unprecedented new challenges, which Dr. Hahn will explain in a bit. We are engaged in an all-hands-on-deck approach to make sure Idaho is ready when the initial supply of COVID vaccine is available. I am directing the Idaho Department of Health and Welfare to convene the new Idaho COVID-19 Vaccine Advisory Committee, made up of a large cross-section of stakeholders representing a variety of organizations. The committee will guide and advise me on strategies for access to COVID-19 vaccinations statewide. We'll have more information to share on the committee and its membership next week. With that, I'd like to invite Dr. Chris Hahn and then Dr. Carolyn Bridges to speak about the process around COVID vaccine preparation and the rollout, and then we'll take your questions. Chris?
Thank you. Thank you, Governor. First of all, as you heard, we are not passing out of stage 4. And as he mentioned, we are concerned. We do see a rise in cases around the state. I just want to make it clear, many parts of the state are seeing these increases. And we are concerned with fall coming on, more people in school, more people inside, that we will continue to struggle with rising case numbers. Additionally, we continue to have more people in the hospital than we'd like to see. We're gratified that right now, despite the rising case numbers, we have not seen a bump in hospitalizations, but we know there's sometimes a lag, and we may still see that. So we're working very hard to try to encourage people, as the governor mentioned, to get their flu shots. Do everything you can to stay healthy and safe. Wear your mask, protect yourselves from not only COVID and not only flu, but other respiratory viruses and diseases that circulate this time of year. So I'll just say a word about vaccine planning before Dr. Bridges gives us some more details. First of all, we are working under guidance from CDC. CDC released guidance to the states on how to plan and prepare. And we've been directed as states to have our plan to CDC by October 16. So that is in the chance. The governor mentioned January, but you've also heard talk of November. We don't know if and when a vaccine or the first vaccines will be licensed in the United States against COVID, but we want to be ready should it become available in November. So our plan will be submitted to CDC October 16th. This is a new vaccine. The challenges are many. The first one is many of our immunization programs and plans, we talk to people about vaccines that have been around for years and years, and we can talk about the safety record, we can talk about what great benefits that vaccine has already shown, whether it's a flu shot or whether it's a meningitis shot. This is a new vaccine. We're all going to be talking about it without that history of years and years of experience with it. We need to work hard doubly hard to communicate, not only to the general public about this vaccine, for which there is, of course, concern about safety and efficacy. Concern is it being pushed out too quickly. We need to not only stay informed ourselves, but communicate, first of all, to our healthcare providing community, our doctors, our experts in vaccines around the state, so that they also feel comfortable not only receiving the vaccine, because healthcare workers will probably be among the first or the first group vaccinated to be offered that vaccine. They need to be comfortable with it themselves. So that is one reason why the advisory committee that the governor announced will certainly include representatives from the healthcare sector around the state. Lastly, a couple other challenges I want to mention is it's possible that they will require 2 doses. Some of you might remember from 2009 H1N1 pandemic response that 2 doses were required to gain protective immunity against that virus. So that is very possible. Some of the vaccines being studied in the United States and already in clinical trials are being studied with 2 doses. So that adds an extra challenge, right? Making sure that the people get the first dose are able to come back and get that second dose. Additionally, people who do the vaccinations will need to be protected themselves in case some of those people coming through the line and lining up for vaccines, they could be unknowingly infected already. So the workers will need to have proper protection and safety guards put into place. To meet these challenges, in addition to the advisory committee working to educate and talk with healthcare providers and others around the state, essential workers, police, fire, other workers, teachers that we want to hopefully be able to offer the vaccine to, those folks also need to be sure that they're comfortable and aware and have the information that they need. The goal is that nobody will need to pay a cent for the vaccine. The federal government has purchased the vaccine. It'll be provided free, and doctors that offer those immunizations can bill insurance. For people who are uninsured, we are working on processes so that the doctors can be reimbursed through another mechanism, not by collecting money from the patient. Lastly, I just want to mention the last challenge, because the 2009 pandemic, I have fond memories is not the right word. I have strong memories of this. My kids were little, and they were of the age group where they went first. I took them through to get their shots, and then I got mine later. This is going to be different. We are going to be almost certainly targeting adults first, whether they're healthcare workers, seniors living in nursing homes, other essential workers. We're going to be focusing on encouraging adults to get vaccinated, offering it to those groups first. Again, initially in a very limited supply, and then eventually a broader population. So lastly, I just want to repeat that we are committed to providing the best information we have We're committed to staying abreast. Both Dr. Bridges and I participate and listen to the CDC's deliberation on this vaccine, which is very frequent, so that we can stay abreast of the science and be familiar with what's going on. And we will make sure and communicate that as we go. And then with that, I think I'm going to let the governor introduce Dr. Bridges.
Thank you, Dr. Hahn. When we first started in this effort and put the coronavirus working group together back in March, one name that we were delighted to have was Dr. Carolyn Bridges, who's a indigenous Idaho person who, as I stated earlier, had just retired from CDC. She's done yeoman's work on not only the coronavirus working group, but on other areas. And she's literally an expert in this field, and we're delighted to have her. So, Dr. Bridges.
Thank you very much, Governor. It's really a pleasure to be back in Idaho. As Dr. Hahn and Governor Little both mentioned, the state of Idaho is working very hard on planning for the implementation of a voluntary COVID-19 vaccination program. Although the exact timing of when a vaccine or vaccines will be available and the number of doses that will be available at any given time is difficult to predict, planning, as they both mentioned, is critical. We all benefit from prior vaccines that now protect our communities from infectious disease outbreaks and the lessons learned from those vaccines. Large outbreaks from smallpox, polio, hepatitis B, and other vaccine-preventable diseases did not occur that long ago, but have been largely, in some cases, have been completely eliminated due to vaccines. My parents' generation remembers vividly how afraid their parents were of polio. In fact, two of my aunts who lived near Caldwell had polio as children and were taking care of it at the Elks here in Boise. Polio was declared eliminated in the United States in 1979 and was declared eliminated in Africa just this year. Smallpox was declared eliminated worldwide in 1980, both due to global vaccination programs. In the U.S., several new vaccines have been developed, licensed, and widely implemented in the last 20 years. These new vaccines prevent shingles, influenza, hepatitis B, bacterial meningitis, and even certain cancers. The processes for monitoring the safety of new vaccines are well developed and include multiple layers of oversight. Just like with any medicine, any vaccine can cause side effects. But for the most part, these side effects are minor, like a sore arm, fever, or body aches, and go away within a few days. These types of side effects and more serious side effects are being monitored for in current COVID-19 vaccine trials by manufacturers, by researchers, independent data safety monitoring boards, the FDA, and CDC. So multiple layers to monitor and ensure safety. FDA also requires extensive safety monitoring after vaccines are approved for use. This allows for the detection of rare adverse events from any vaccine, including any COVID-19 vaccine. FDA and CDC will be jointly monitoring COVID vaccine safety long-term. In terms of the speed of manufacturing, the ability of scientists and manufacturers to make vaccines of COVID-19 has been aided by substantial investments by the U.S. government over more than 20 years. Governor Little mentioned the investment this year, but this really builds on a long history of recognizing the importance of vaccines and the need to improve those systems to manufacture and monitor them. These investments have led to scientific innovations and improvements in vaccine candidate development and vaccine manufacturing capacity to support more rapid vaccine availability. These systems are hard work now to develop new vaccines for COVID that will go a long way to helping our families and communities return to school and work and to normal social gatherings with our friends and loved ones. I have confidence in the vaccine development and safety processes, and personally have volunteered to be in a COVID vaccine trial myself although I haven't been selected yet. I'm hoping I will. In the meantime, while we wait for COVID vaccines, please do check with your doctor or pharmacist to ensure that you're up to date on current vaccines. Only about 1 in 4 adults is actually up to date on their vaccines, and many children are also missing 1 or more routine vaccines. And as Governor Little has said, really, we want to make sure everyone gets their flu vaccine this year. That's going to be particularly important. And as a reminder, flu vaccine is recommended for everyone 6 months of age and older who does not have a contraindication to flu vaccine. Thank you.
Thank you, Doctor. By the way, Teresa and I are getting our flu vaccinations this weekend. So with that, we'll take your questions.
Governor, Melissa has a question
Okay.
over Zoom, so we'll see how this works and it's.
All right, we're going to do the beta test model on Zoom, so here we go.
Hey, Governor, this is actually a question for Dr. Hahn or Dr. Bridges. The Atlantic reported earlier this week that there were even more challenges to this vaccination than you mentioned, Dr. Hahn, namely that they're extremely fragile so far and they have to be stored at extremely cold temperatures, and we're talking up to, or as cold as negative 94 degrees Fahrenheit. And that makes it difficult to ship and store. So what, if anything, is being done to make sure that rural Idaho hospitals won't be at even more of a disadvantage when receiving this vaccination?
We're having a lottery up here to see who gets to answer.
Yeah, Melissa, great question. As you mentioned, there are some challenges. We didn't have time to go through all of them. There are many. The question is about the very possible need for very cold storage. First point is that is one of the vaccines, under development. We don't know yet if that's the one or one of the vaccines that will be approved. And secondly, CDC has already informed the states that they will purchase needed freezers and make sure that they're distributed if that type of cold, extreme cold vaccine is, storage for a vaccine is required. That said, and Dr. Bridges could elaborate on this if there's more discussions been had, but we certainly realize we have to be ready for that. It's outside of most vaccines either can be stored in a refrigerator or possibly a normal freezer, if you will. So I don't know if there's more detail to that you want to add, or if that's pretty much.
Well, Yeah, I'll just mention that the storage and handling issues for the vaccines are going to evolve over time, and the vaccine manufacturers are working on their storage and handling requirements and stability of vaccine issues. So, for example, that vaccine that you just mentioned that requires the ultra-cold storage, now they've announced that it'll be able to be at refrigerator temperatures for a week. So things are evolving, and we'll have to, stay on top of those issues.
Governor, James Dawson has a question for you now from Zoom.
Okay, James.
Hey, Governor. In regard to your rapid antigen testing announcements going to schools, who's going to be eligible for these tests? Is it going to be teachers, students, staff, and will they be available for asymptomatic people as well?
I'll let Chris finish up on this, but as I said, we're going to send it out to the health districts and let them prioritize it in consultation with the state. Dr. Hahn?
Yep. Governor, that is correct. And James, yes, our first shipment we're told this morning has arrived. Those will go out to the public health districts for use for schools. The main priority is going to be for teachers and staff. We want to make sure we can keep those schools open. They can't operate if the teachers aren't there or the staff aren't there. These tests were designed for symptomatic or sick people. That said, the federal government has given us allowance to use it potentially for surveillance or asymptomatic. We are actually working on protocols. I just saw a protocol today that we hope to get that out with those tests, so the health districts know how they're best used, and we're hoping to have that discussion today with our health districts. So very rapidly evolving situation as these tests arrive, but the main priority is going to be for teachers and staff.
Thank you.
Another Zoom question from Thomas Plank of the Idaho Press.
Thomas?
So with this spike, is there at all a chance to go back to stage 3? I mostly ask this question because it appears that we now are caught in stage 4 forever. But is there a chance that we ever move backward? Or are we going to be just here for, until the heat death of the universe?
I'll start off with my famous quote, never say never, never say always. But we still have, I think we're down to less, for a long time, we had half our counties that had less than 10 cases per 100,000, which obviously means that it's an isolated area. I don't know if you can see it, but I always refer back to this chart. We have a couple areas in the state where we're concerned about healthcare capacity, but overall, we're still okay. But it's concerning. I don't see, if that's why we do these things. If people continue to do the right things, that issue won't arise. But I would, you never know what's going to happen. This novel coronavirus, and it is a novel coronavirus, it does not act like other viruses. The fact that we've had this run up all summer long, and we anticipate there's going to be a further run up in the fall. That's why we emphasize people having the flu vaccine, because if they get the flu vaccine, that means we'll have the healthcare capacity. That in essence means that red line goes up further. If people don't get their flu shot, that red line goes down slower. So.
Governor, thank you. You mentioned that healthcare workers are top priority for receiving the vaccine. Where on that priority list would you anticipate elderly and immunocompromised people to be for that priority list for the vaccine?
Well, I'll let Chris finish up on this, but we've been talking about this ever since March, about what that is. And of course, one of the things that we didn't know early, we know now, is what Dr. Hahn talked about the elderly. So obviously we got to, that again, I'll go back to my red line, my pacifier, is that I got to protect my healthcare workers or everything else is lost. And then the most susceptible population will be the older ones. But that, as we learn more about the vaccine and how it works, that will probably be a dynamic process, Chris.
Yeah. First, I wanted to emphasize that although we believe healthcare workers will probably be the first group to be offered the vaccine, that has not been finalized yet. Several important groups are weighing in on that. The National Academy of Sciences, you may know CDC, some universities have all looked at, first of all, looking at the models. For example, by vaccinating healthcare workers, if some of those healthcare workers work in long-term care facilities, that might be the best protection for those seniors. We know sometimes vaccines don't work so well in seniors because their immune systems aren't able to really mount a good response even to the vaccine. So the best thing we can do for them is probably do a ring of protection around them by vaccinating those workers that come and go and can bring the virus into that facility. That said, seniors are definitely way up there. It is possible that when the vote comes, they will end up being first. We don't know that for sure, but what we hear over and over again is healthcare workers, other essential workers, and seniors.
I'm afraid reporters and governors are last.
Hi,
Clark.
Governor. Thanks for continuing to do these press conferences and share information. I just wanted to get a little bit more information from you or from Dr. Hahn about the testing program for our schools. And one of my questions is, how quickly might these new tests be available to those schools? If I'm in eastern Idaho and I have an exposure event next week and I've got some staff that I have to quarantine, how quickly would those tests be available at the school level to deploy?
Well, I'll let Chris finish up, but as I said, we're going to send it out to the health districts. And one of the things that's taken place all along this, as you well know, is all our school reopening plans have been in conjunction with the health districts. Statutorily by law, they're the experts that work with our fine public health staff here to best determine in their area where the most critical demand is. And Chris, you want to add to that?
Yeah. Yes. As the governor mentioned, we received those first tests today. So this is really a rapidly moving thing. Speaking to our state lab, Dr. Ball, who's the director of the lab, he believes they'll be able to start shipping those out this week. So we're hoping that they'll actually get to the health districts by the end of the week or early next week. They have to they come in pallets, they have to break them down and package them. So there's going to be a little bit of a processing, but they're hoping to get them out this week. That said, as you know, any new thing comes with, it's getting a new appliance, right? You have to kind of read the instructions. So everyone has to get trained on how to use these tests properly. I'm hopeful, though, to your analogy, that if something happens mid next week, that these tests will be able to be used. I can't guarantee that, but I've read through those instructions myself. It seems pretty simple. Hopefully, it'll be very quickly be able to put into use.
Thank you.
Mm-hmm.
Hello, Governor. CS2 Scott Logan has 3 questions. His first question is related to the rise in COVID and our state's economy. Governor, sir, how would you characterize or describe the state's economy as we have been treading water, so to speak, in stage 4? Are you worried about what may be on the horizon as COVID cases increase?
Well, the question about the economy, if we're trading water, everybody else is sunk. We're ranked, our numbers are, our employment numbers recovery are 10 times better than the national average. We're third best. We have got to continue to do what we've done on the COVID side to keep the trajectory that's going on economically in Idaho. Yesterday was the end of the was the end of the month. In about a week, we'll have receipts into the state. Our economy is not treading water. Our economy is doing quite well, but it is contingent, as I said, on that interlock between people feeling comfortable, their employees feeling comfortable, consumers feeling comfortable, to where they can go out and we can continue to expand the economy.
The second question is about COVID and the election coming up. Governor, do you feel confident going into this historic election that Idaho is prepared for it, given the unprecedented emphasis on mail-in ballots? And have you heard from other states and how, if they're prepared and how?
Well, this, whether it's testing, whether it's school opening, so many of these issues are best resolved at the local level. By law in Idaho, the county clerks are the chief elections officers. Every county's a little different. The polling places are a little different. We started looking at this last April for our May primary, but there was good consensus that we should have an all absentee election then. Part of the reason, the primary reason I called the special session was for the legislature to weigh in and create a scenario to where people could safely and openly and have access to the electoral process. There's going to be some hang-ups, little hang-ups around the way, but there's a lot of resources available to these counties, whether it's new polling places, whether it's PPE, whether it's paying for new poll workers. So I think we're going to be in a good place here in Idaho, particularly compared to the other states.
This final question is regarding President Trump's new proposal for a low number of refugee admissions to 15,000 in 2021. Do you have any comment about that?
I haven't seen it. I have.
This is a question from Alex Grant, journalist at our station. What can be attributed to the recent rise in cases? Do you suspect it's schools reopening, restaurants and bars? What can you attribute that to?
Well, I'll let Chris talk about it, but I think it's a D all of the above. One of the things we talked about this morning, as if you were driving around here a week and a half ago in the Treasure Valley when all that smoke was in the air, people were inside. There was basically recommendation from the public health people and DEQ for people to stay inside. I think that might be an indicator of some of the things that are going to happen this fall. Every time I talk to Dr. Hahn, she talks about those small gatherings, and I'll let her tell you about it.
Yeah, absolutely right. We asked the local public health districts. You may have just seen the story in the Idaho Press about the contact tracers and the work they're doing. And really, not only are they interviewing people to say, hey, what are your symptoms and we need you to stay home, but they always ask, where have you been? Where have you been that you might have picked this up? Because that's the only way we'll understand what's going on. And what we hear from the districts, every week we ask them this question, and every week they say, right now it seems to be those, smaller gatherings. The big venues are all closed, but people are still getting together. And as the governor alluded to, we were worried a little bit about Labor Day, whether that played a little bit of a role in this, accelerating this. Kids are coming back to school and back to college. I think there's a kind of an all of the above type of thing going on. It's a reminder to all of us. I think we all let our guard down a little bit when we're around family, even if that family's 10 or 20 people. It's a little bit of a bigger crowd than we're used to. So just a reminder that as fall comes on, all those things that we're worried about are going to only accelerate. More kids in school, colder weather, people being indoors.
Dr. Bethany, Mark, correct me if I'm wrong, but it seems like back then you said your job was to manage this thing, the pandemic, and hold on to the vaccine. Now, 6-7 months later, the economy says doing quite well, considering 4.2% unemployment. Also, 40,000 infections, more than 400 dead now in Idaho. How would you say that you've done in managing this pandemic to this point? And are you satisfied with all those numbers and about?
No, I would love to have 0 fatalities and 0 cases, but it is somewhat of a balancing act, and what I have to do is lead by example, put adequate resources out there. When we started, we had areas where this blue line was going above the red line, the Magic Valley, the Wood River Valley, but we've done all those things on that list to increase healthcare capacity so that we could default to state law, which is health districts and local elected officials making the call, and then we're trying to give them the resources. If I went back in a time machine, would I do some things different? Darn right. But this is a dynamic process. There's new science coming out, there's new programs coming out, there's new information. We know better sociologically how people react to this. There's some things we do different. But like I said, the no action alternative would have been a disaster for everybody. And no state, and I don't think of hardly any country that had the no action alternative. The question is, did you do the right thing at the right time with the information that was available at that day? And I hope and pray I did.
Governor, Melissa has another question.
Governor, you spent a lot of time talking about emergency orders and their role in the state. Lawmakers have indicated or been very clear that they want to change the way emergency orders are handled by the executive branch, and possibly even local government control over things like school closures and mask mandates. If the legislature does try to change anything regarding your powers, will you veto it?
That's sheer speculation. As I said, all 50 states have emergency orders in place. And I think there's probably some issue about the length of emergency orders, about the duration, about legislative input. But I would be adamantly opposed to no emergency orders, because that's what you do in this job. Whether it's a natural disaster, whether it's a flood, a fire, an earthquake, a volcano. Remember, we had an emergency order when we had Mount St. Helens here in Idaho. The state governor has a responsibility and accountability to the people to respond to an emergency, and both state law and federal law refer to that, and they'd have to change both of them.
Governor, James.
But lawmakers were pretty clear that they thought that this emergency order had gone on too long, and they wanted a commitment from you to end that order. And speakers on the Senate floor, they made it sound like you had committed to that. Have you changed your mind?
I haven't changed my mind.
Governor, James Dawson had a question.
Governor, with your announcement that there's going to be this new vaccine committee that's going to, I guess, convene next week, or more details will be available next week. What do you make of the CDC having that Idaho has the second lowest vaccination rate for kindergartners in the country? How big of a challenge do you expect it will be to convince Idahoans that getting a COVID vaccine is a good idea?
Well, in response to Keith's question, I talked about the sociology of this issue. We are, our mandates for vaccinations in Idaho are pretty minimal, but we have to get to a certain level. And I would almost argue that not having a mandate will make it easier.
Why is that?
I think people will sit down with their community, with their healthcare provider, with their families, and do the right thing.
Do you think that that's accurate, though, considering that vaccination rates have gone down as Idaho has loosened its requirements for people to get vaccines, when they send their kids to school?
Well, that's state law in Idaho right now. Keith?
To pick up on James's question, there are lawmakers who are actively opposed to vaccinations who will probably speak out and try to convince people not to get this COVID-19 vaccination. How are you going to deal with that?
That's why I've got these two esteemed healthcare professional doctors here to explain to all the people of Idaho what this is, and we will continue to do that. We will continue to try and address the concerns of anybody in Idaho, particularly about the safety, but also about the necessity of having the vaccine, a safe vaccine, and having it available.
This question is for Dr. Hahn. Can you, piggybacking off of what Madeline said, can you talk about some of the trends you're seeing right now, specifically the increase in cases ages 19 to 25? Why is this happening? People are getting lax. I talked to CUH yesterday. How can we get ahead of it instead of staying in stage 4 or the THC?
Yeah, thank you for that question. That is the big challenge of our time right now. As people come back to college, university, as kids go back to school, as we all try to get the economy going, go back to business, how do we, especially with young people who tend to think they're invincible, of course, how do we try to decrease the rates of disease we're seeing in that age group? Because if you look at it by age group, it looks like that's really the highest by far is in our 18 to 29-year-olds. And if you look down a little further, you can see it's even in the younger half of that age group. So we need to continue to work, and I think our universities are doing a fabulous job with some of their campaigns. I'm sure you've seen some of those. To really convince young people, especially it's not all about, it's not all about them. We know that they'll probably be just fine if they get COVID, but passing it on to a loved one, passing it on to a friend who might have a health condition. A lot of people don't even want to talk about their health conditions. You may not know that your best friend, is on an immune suppressing medication. You may not know that somebody has a condition because nobody walks around with a sign. So really trying to educate young people particularly about protecting others. And I think the universities are doing a really good job with that, but trying to continue to use the force and the, when I say force, I mean the media power and the voice that we have as public health to support the universities and support messaging going out to young people. I think that's the best we can do right now is through education. And because, nobody's going to police this, right? Nobody's going to follow people around. It's got to be a willing change.
Sorry for all the questions. It's Madeline again. Hi. What's the plan? Is there one for people who plan to vote in person on November 3rd but catch COVID and they have to isolate? I'm wondering if that's been addressed and if there's a workaround in mind, or can they just not vote because they don't want to go to the polls?
Well, I, as I did in the primary, I urge anybody that thinks perhaps they were just exposed or perhaps they're going on a trip to go to idahovotes.gov and get an absentee ballot right now. I think that, and I don't know, you could talk to the Secretary of State's office or your county clerks if you're positive, whether there's a place where you can go by and they can hand you a ballot I know they talked about that. I think that was in the voting center bill that the legislature recommended that they didn't pass. That is actually a good question. If you're COVID positive, how do you exercise your constitutional right to vote on election day? That's why I'm urging everybody to use our very dynamic absentee system we have here in Idaho. I don't know, do you know? We'll get back to you.
Thank you.
But it's a good question.
Thank you.
Okay. I want to thank you all, and I particularly want to thank Dr. Bridges and Dr. Hahn. You can see that Idaho is in good hands with those two experts. So thank you very much.